Stroke. What occurs in a stroke? So there are two types of stroke. There's a hemorrhagic stroke, which is essentially when the arteries supplying blood to the brain rupture or burst, causing a decrease in blood supply to that brain region. Or there's an ischemic stroke, where the arteries supplying blood to the brain are blocked, and that can be due to a embolus or a blood clot, or it could be because of the arteries themselves are very narrowed. In either case, the blood supply to the brain is being blocked or inhibited, and the areas of the brain corresponding to that blockage are typically the areas that are affected. Um, Things that can be affected are just motor function, like your ability to move, or speech, or vision, or even hearing. Now, the the artery that is most likely to be affected is the middle cerebral artery. This accounts for about 70 to 80% of strokes. And typically, patients who suffer from an MCA stroke present with weakness on the opposite side of their affected brain region. And there usually is some sensory deficit, which includes like inability to feel, touch. What are some risk factors that predispose you to possibly suffering a stroke? One big uh, risk factor is hypertension. The increased pressure in your arteries are more likely to make it rupture. Also, cardiac disease, diabetes, smoking history, and history of a TIA, which is a milder form of a stroke. These all predispose you to suffering a stroke in the future. So be mindful of those. Now that you know what kind of occurs in a stroke and the risk factors, um, it's important to know some of the signs and symptoms of stroke. So a good way to identify if someone's having a stroke is to act fast, FAST. Um, we're looking for facial asymmetries or facial drooping. So if you see someone having a facial droop, ask if they could smile. If they can't do that, then that's that's possibly an indicator that they may be suffering a stroke. Now, next you have arms. Considering the arms, um, is one weak or numb? It's like one arm weak or feeling numb. You can ask the person to raise both arms, and if they can't raise one or the other, um, that may also be an indicator that they are suffering from a stroke. Next is the S in fast. Is their speech slurred? Ask the person to repeat a simple sentence from you, like "I have a cat," and if they repeat that to you and there's some slurring of the speech, that also may be an indicator of stroke. So it's important that you identify these signs and symptoms in a timely manner and call 911 or the appropriate medical emergency services, so that they can get the individual to a hospital as soon as possible so that they can be medically managed and reduce the impact of the stroke. What can a physical therapist do for someone who has suffered a stroke? It's important first for the patient to be evaluated by a physical therapist to identify possible deficits or things they need to work on due to suffering a stroke. And what a physical therapist can do is make the evaluation and drive what we call neuroplasticity, which is essentially reorganizing the connections of the brain to areas that may have lost function. Um, the physical therapist can work on this to improve bed mobility, transfer, and other functional exercises or walking, to really regain the things that were lost during that stroke. If you or a loved one or someone you know who has suffered a stroke, it's important to get them the care that they need and get them evaluated by the medical professionals that will be able to help them regain their function. So reach out to your local physical therapist and see what they can do to help you out.